Positive coronavirus cases continuing on an upward trend here in Arizona. Experts predict cases will continue to rise as people go out and about, enjoy each other and the holiday season. So Dr. Ross Goldberg, he's good enough to join us every week, resident of the Arizona Medical Association and District Medical Group Vice Chair of Surgery at Valleywise Health. So we bring you in every week, first of all, because we like you. It's good to see you. And second of all, because you do have your finger on the pulse of what's going on. So, it seems like week to week now, we're talking about a worsening situation when it comes to cases, and probably more worrisome for people like you, maybe more serious illness as more people are in the hospital.
Yeah, first, good morning. Happy Thanksgiving to everyone. It's always a pleasure to be back. But yeah, numbers are going in the wrong direction. Hospitalizations are going in the wrong direction. There is a concern. We're in flu season. There are other illnesses we see this time of year. And now you have coronavirus on top of it. And the numbers, like you said, are going up. So this is all a great concern for all of us watching. And we're just hoping everyone continues to do their part to try to stop the spread of this.
Can you describe what it's like now? And do you still have and still see in our hospitals totally separate COVID type wards and wings and things like that? And what is it like in those right now?
Yeah, no, we've always had set up separate COVID units. Again, you wanted to separate people out. What's interesting right now, at least I can say from our hospital, is that you've got people in the hospital, but not the overwhelming number in the ICU at the moment. There's a different approach to it now, but there are more hospitalizations than we had previously, minus the surge we had in the summer. So those are separate units. Those have different protocols. We're still wearing all of our PPE throughout the hospital system, but in those units, obviously, there are some extra protocols taking in place when you go in and out of each patient's room.
Why do you think we're not seeing as many people in ICU? Is it the virus itself, or is it the way that you're able to treat people now?
Well, I think it's a mix of things. First of all, the ICUs are still busy. Don't get me wrong. They're busy with other things that we see this time of year. So they are still pretty full. The number, if you look at percentages, are not as much coronavirus right now. I think it's a different patient population. Our treatment regimens have changed in the last few months. And I think where hopefully people are noticing when they're getting ill, they're coming in and getting treated, and we can be more aggressive with it. So as things expand and we learn, though, as we pull more people out of the ICU and more into the treatment, obviously getting them out of the hospital completely would be great, or not getting it would be great. But we are adapting and evolving as we learn about this.
The governor earlier this week came out and said that he was going to give another $25 million in state funding now to various hospital organizations to try to boost, I guess, personnel and different things like that. $25 million is a lot of money, but in the scope of what we're dealing with here, is it enough at this point? And do you still need more resources?
Well, I'm never going to say no to resources in general. If you look across the country, the difference between what happened to us in the summer and now is that everyone's going through a surge simultaneously. So that stretches all of our resources at once. The last time it was kind of like a rolling wave across the country. So there were hot spots that we could send resources to and people kind of shifted and moved. It's harder now because we're all in the same surge. So any resources that are available will be greatly appreciated. Any money, personnel, whatever we can do. But obviously, it still comes back to people doing their part to try not have to get to the hospital and preventing from getting the virus in the first place. That would be the biggest help.
Right, and that makes sense, because I do remember, some nurses were going from one hotspot to another hotspot. Well, when your whole country's a hotspot, nobody can spare anybody.
Correct. And the last number I heard was there were like 20,000 plus positions being recruited for. We don't have that many people. We're a finite resource. People talk about beds. I always talk about staffing. That's more important, is do you have the personnel in place to take care of the people? You can have all the physical beds you want. If there's no resources or staff, the beds are useless.
There was some talk, and we're almost out of time, Dr. Goldberg, about basically either curtailing or stopping some of the elective procedures again because of COVID. Are you seeing the need to do that anywhere? Because, a lot of these quote-unquote elective procedures are very important to people.
They are. And it's, again, what we're doing at our hospitals, we look at it as a day by day. We have not stopped. We are still taking care of patients because they have other medical issues we need to take care of. It's just, how do we plan and prepare for it? If I know I need to do an urgent medically case that needs overnight stay or ICU, it's just planning that resources and mapping it out. Again, I always go back to the leadership of my institution. They're very transparent. They're very easily approachable with these things. And what we're doing is just planning. As a surgeon, that's my life anyway. We plan everything when we're in the operating room. It's just planning for afterwards as well.
Dr. Ross Goldberg, thank you so much for joining us today, and thank you for all the work you and your colleagues and your teams are doing here in the Valley right now. Talk to you next week. Have a nice weekend.